The mask mandates. It turns out they did nothing at all from a public health perspective, and now the data is in. We have a large study to review, but we don't even need to go all the way there. We can go to the New York Times, which actually published this as an editorial, and oh my goodness, did the New York Times readership ever go crazy? We'll take a look at that too. This is the article. It's an opinion piece by Brett Stevens here, and it's the mask mandates did nothing. Will any lessons be learned? What he writes here is the most rigorous and comprehensive analysis of scientific studies conducted on the efficacy of masks for reducing the spread of respiratory illnesses, including COVID-19, was published late last month. Its conclusions, said Tom Jefferson, the Oxford epidemiologist who is its lead author, were unambiguous. There is just no evidence that masks make any difference, he told journalist Maryanne Demasi, full stop. But hold on. What about N95 masks as opposed to lower quality surgical or cloth masks? Nope, no difference. What about the studies that initially persuaded policymakers to impose these mask mandates? They were convinced by non-randomized studies, flawed observational studies is the conclusion, and there's no difference that these things make any difference, and there's no observations anywhere that support the idea that anything makes any difference at all in terms of lockdowns, in terms of hand washing, any of that stuff. Do it, don't do it. Respiratory viruses are going to respiratory virus. The virus is going to virus. Now, interestingly, no study is ever perfect. Science is never settled, he writes here. It doesn't prove that a mask properly worn has no benefit at the individual level. So it could. However, there's nothing that shows that population level benefits of masking exist. So it just doesn't exist. Now, what was this? It was a Cochrane analysis, which means it was a collection of different analyses put together. They rate the studies in terms of high, medium, low confidence. They pool them. You get to look across all of them. So it was 610,000 plus participants in all these different studies, which they pooled and said, do these things work? And the answer was unequivocally no, they do not. So that's what the article is all about here. And of course, I like how he goes on here to talk about how the CDC is sticking to its guns and is just trashing its own reputation. And of course, what does he say here? The CDC's increasingly mindless, good, that's at best, adherence to its masking guidance is none of these things in terms of being humble, transparent, open to criticism, honest about what it doesn't know. That's what science is. CDC is none of those things. It isn't merely undermining the trust it requires to operate as an effective public institution. It is turning itself into an unwitting accomplice to the genuine enemies of reason and science. And that is what has happened more and more. We have genuine enemies of reason and science out there now. And these are people who are operating from a system of belief, not from a system of understanding, not from a point of curiosity. It's not good. So, at any rate, interesting article. You should read it. But what caught my attention most was looking at the reader comments over here. So let's take one or two of these right now. So here's MPNET. What I did was I sorted this by reader pick. So 3,710 people who read this said, yeah, we agree with this statement here by MPNET out of the Midwest saying, Mr. Stevens, we expect better from you. I like the scolding tone there in MPN. That is good way to start. You've misstated the conclusions of the study is ably pointed out by several comments preceding this one and deployed them in support of ideological, not scientific arguments. You might accurately have said that the mask mandates did not work because there was insufficient voluntary compliance and no effective enforcement. You might say there's no point in ordering all Americans to do anything because we just won't and can't be made to. Neither of those sound much like something you'd say, though. MPN's argument is, we just didn't enforce it hard enough. If we had just enforced it harder, then it would have worked. Now listen, MPN, we actually ran a fairly large study in the United States. It was called All 50 States. Some of them didn't have masking. Some of them did. Some of them had very high levels of self-compliant masking. Vermont, for instance, right? So there should have been, at the epidemiological level, some difference in outcomes between totally unmasked states and masked states. That just stands to reason. There ought to be something there, and it's just not there in the data. But MPN scolds Stephen for not being very scientific and then comes out with the conclusion that, you know what? There was no effective enforcement. That's it. We just needed more enforcement. That's what obviously the problem here was. Okay, carrying on. Let's see what else people came up with here. Reading your column and then reading the underlying study, according to JRF here out of Los Angeles, gave him a feeling of extreme whiplash. The study does not say what you say it does. Instead of a comprehensive and convincing confirmation of the null hypothesis, the actual study is a messy and uncertain picture that shows it's hard to study this topic because in many countries across many respiratory illnesses, compliance is really bad. People don't wear the masks. Okay, so the issue here, JRF, is you're just basically saying, well, we just failed to use them well enough. Again, some of these studies actually are taken in hospital settings where people are presumably doctors and nurses. They're trained. It's a controlled environment, and you have the best possible control for that. That was part of this study. So to say that, well, that just isn't there. Now, listen, we don't have any data from any particular place that says respiratory viruses are stopped by masks. We don't have that data. If we had that data, JRF, this would be a great thing to actually surface, but it doesn't exist. So let's carry on. What else are people saying? This one. A recent CDC study reports that N95s reduced one's odds of infection by a factor of 6 relative to unmasked individuals. That's very significant in terms of reducing the rate of illness for vulnerable individuals. The problem is, if this is the study I'm thinking of, this one was complete junk, but I would like to see which one they're talking about. But I've seen some very bad CDC studies on this topic, really awful. So if this is the one that I'm thinking of, it's not a great study. How did people reply here? Yeah, nobody's really supporting that there. Why is Mr. Stevens, writes BC Chad out of Brooklyn, writing this column about mask mandates? The findings are basically nonsense. Mask mandates help limit the spread of the virus. Common sense prevails here. The virus spreads through nasal passages. If we are covered up, the virus cannot enter a person's system. I was in a hospital today. Everyone has to wear a mask. Science? Really? I'm sorry, but masks saved lives of many people. Still do. Okay. Listen, BC Chad. That's a whole lot of assertions right there. We can feel your emotions coming up. That means we're in a belief system. We're not talking about an opinion or anything like that. But to say masked mandates helped limit the spread of the virus, then that ought to be there at the state level data. There's no difference between the states. Masked, unmasked, rates of spread, penetration didn't make any difference. That's just what the data says right now. So just kind of how it is. And I agree. It kind of makes sense. You would think it makes sense that if my face is covered and this is a respiratory virus, it ought to help. But the problem is if that respiratory virus is a tiny, 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 tiny thing compared to the weave of your mask. So I agree. If you're in a full filtration thing, you got a suit on, one of those space suits in a BSL level 4 lab, yeah, sure. Those things, you can actually do that. But in terms of people wearing masks, what we're talking about, a mask mandate, is for the government to say we want all people to wear masks. That's fine, but we've all seen how people wear masks. Heck, we see people who stop at the bottom of the escalator and stand there with their luggage, not understanding that there's 200 people coming right behind them. We see people do all kinds of crazy things all the time. So a public health policy always has to be geared around what's actually going to work out in the real world. So we have real people to deal with, and some of them are really not very intelligent or smart or thoughtful or not careless. So that's just part of the deal. Second, when we say masks, what are we talking about? If the government at the beginning of the pandemic had said, we saw all of this coming well in advance, heck, we were funding gain of function research, as we now know. So we're the government. We stockpiled huge amounts of N95 masks. If every household in America got a QR code that brought you to a 1-minute video that showed you how to properly wear an N95 mask, and then we all got a big stock of them, and then, we were all trained, and then we all used them, maybe, but a mask according to the government. Didn't you see this? Do you remember when Jerome Adams, the Surgeon General, sat down and showed people how to fold a T-shirt up and wrap it around their head, right? That was a mask in a triage situation, according to the Surgeon General in the United States. It was extra funny because he didn't just pick a mask, but he picked a T-shirt to make a mask out of that read "Got naloxone." And naloxone, of course, is the substance used to treat somebody who's in an acute opioid overdose situation. So just the symbolism of that whole thing was troubling, to say the least. We saw people using surgical masks flopping around, people wearing their masks as chin straps, right? The whole 9 yards. We didn't have any effective masks or masking practices. So there's that. But secondarily, Chad, they don't even work in the hospital situation, according to the studies we have. So there's that. All right. Anyway, I just want to talk to you about that because that's kind of funny. You should go read. There's just dozens and dozens of comments, but we can clearly see from my perspective that there are people who are unwilling to relinquish the idea that maybe they were misled, maybe they were fooled, maybe the masks didn't work. They're unwilling to even entertain that as an idea. Got it. I understand. This is going to be a long, hard road back for some people because they're going to have to admit that there are health authorities who they followed and trusted. And trust is a good thing. It's good to have trust in your fellow humans. But they trusted people who turned out to have been misleading them and, in many cases, knowingly misleading them. That's a hard road to come back from. So, at any rate, that's what I got for you today. Listen, come by peakprosperity.com if you're watching this out on YouTube. Otherwise, see you back here again sometime. All right. Bye-bye.